Now talking about the tissue management. So for making impression, it is necessary that we displace the gingival tissue. Here we have gingiva, we have to displace it so that the impression is really accurate, and we also have to control the gingival bleeding, means we have to control the gingival hemorrhage, and also we have to control the sulcular fluid. So let's just see a small video. Okay, then we have the toothpaste system. Here you can see we have toothpaste. We take out equal quantity on a glass slab and we mix them, making sure that there are no streaks of the material visible. Okay, so mixing time 45 seconds to 1 minute. So we get a uniform color of the material without streaks. Then here you can see putty consistency. Here we have two moisturizer sort of tubs. You take out two balls, equal length, equal means equal diameter. You mix it, and that is the putty system. Then we have the static auto mixing system. So basically, you can see we have a gun here on the front. We will apply this material. It has two cylinders for two materials, right? And in the front we have these mixing tip. Okay, so you can see spirals inside. So when you press that, trigger, we had seen a trigger here, right? See this trigger, black one. When you press this, here will be the cylinder. Okay, so that will lead to mixing of both the materials because of the spiral, and it will come out. Now here you can see we have various tips available, small and large, depending on our use. Okay, you can appreciate the spirals here, right? See, spiral, it helps in mixing. Now what happens is the material, as it sets, it gets tucked into this spiral. That is why this is a one-time use needle. You cannot reuse it. Okay, so base and catalyst paste, as you can see, it gets mixed by the movement through the spirals within the mixing tip. We also have dynamic mechanical system. Here we have internal spiral, which is motor driven, means inside we have a motor that moves and rotates and mixes the material. The advantages here is that it gives uniform mixing, and the speed of mixing is also good, but obviously the equipment is expensive. Acetylene and polyethers are available in this system. Example is Pentamix. This is an example. This is Pentamix auto mixing unit. Inside we have spiral. Automatically it injects, you push the button, you will get the mixed material. Now coming to the impression techniques, we have various techniques, right? We have multiple mix technique, we have monophase technique, we have two stage. So this is multiple mix technique, this is single stage. Okay, monophase we are using a single consistency material. Okay, and two stage we are taking two impressions, and that is also two types. One we are taking with spacer, one we are taking without spacer, and then we have a triple tray, which we'll be seeing. Now this multiple mix or laminate technique, that is a one stage impression, means we take the putty impression and the wash impression recorded simultaneously. So let us see how we do that. So here we can see we are taking out the putty material, orange one and the purple one. We are putting them half on one side and half on one side to check if we have equal quantities of it and the material will be sufficient for the impression. Okay, so you always check it on the tray. Okay, and then you give it to the assistant. See, the dentist is not wearing any gloves. In fact, she should be wearing vinyl gloves. Okay, then we take our syringe and we inject it onto the prepared tooth. Here we have a tooth preparation done. So we are not lifting the syringe, okay, or nozzle, so that there is no formation of air bubbles. Then we take the putty, okay, on the tray. We make a depression and we apply a little bit of, light body on it. And then we, put it inside the patient's mouth and we make the impression. So here we can see this is a one stage method, okay. We are taking the light body impression and the putty impression simultaneously. That is why we call it the laminate technique. Now this approach has a risk of displacing too much wash material by the putty because we are applying a lot of force, okay. So here you can see this is the material. You can see all the yellow light body has been displaced, okay. So that is a little problem. So the critical areas of our tooth preparation, it can be reproduced without the required detail. We need detail, right? So this is the risk, this is the problem with this laminate technique. But the advantage is that it is very time saving. Simultaneously we are doing that, right? And then we have the monophase technique. Here we have only one mixture, okay. One part of the material is placed in the tray and one portion is placed in the syringe for injection. So that is a single viscosity technique. Then we have two stage with spacer, okay. In two stage we have two techniques, right? With spacer, without spacer. This is with spacer. So here you can see we have a putty material. This is the putty of the C silicone. We take it, we place a cellophane sheet on top, okay, and then we take the impression without any light body, okay, only this. We take the impression. When it sets, we remove this cellophane sheet and then we inject the light body onto the set impression and also on the patient's mouth, and then we again take a impression. So we'll get something like this. So here the advantage is that we are getting a uniform thickness because of this, cellophane sheet. We will get a uniform thickness so that our light body will flow very well, okay. So we will have a better reproduction of detail. The drawback is that more material is needed for the light body. Obviously it will create more space, right? So more material will be needed. So here we can see a quick demonstration. We have a tray, we are taking the putty, we are checking if we are taking enough material, okay. And then we are taking the catalyst, we are mixing it well so that there are no streaks, okay. We have mixed it, we roll it, then we'll place it onto the tray, okay. We'll place a cellophane sheet. Because of time I could not cut it. In fact, we should cut it according to the shape of the arch, and then we will make the impression. When this will set, we will take it out, we will remove this, this cellophane sheet. We'll get a lot amount of space and then we'll inject the light body and make the impression again. So that is a two-step with spacer. Two-step. Why two-step? We are taking it in two steps. First, the material is setting, that is step 1. Again, we are taking the light body, that is step 2, okay. Now we have two-stage without spacer technique. So here we don't have spacer. We take the impression as we would normally take an alginate impression. So you can see all the undercuts are visible, all the teeth have been recorded. There are no spacer, right? No cellophane sheet was there. So you will get something like that. And then you pick this up, okay. You pick this impression up, you cut down all the interdental areas with a small BP blade, okay, so that we get space for a light body. Then you inject the light body, right, also in the patient's mouth without lifting the nozzle because we have to avoid air incorporation, and then we make the impression. Then finally we have the triple tray technique. It is the simultaneous maxillary, mandibular and interocclusal check record. Here we are getting the maxillary, mandibular and interocclusal check record at the same time. Here you can see this is the tray we are using, unique kind of tray. Here you can see the patient bites on it, so it will give you both upper, lower as well as the interocclusal record. See, this is the brand available bite registration paste. Is it written here? Let me check. I could not read it properly. Anyway, so this was all about the impression techniques in elastomers. I hope you found the video helpful. I will try my best to come up with a better demonstration video where you can actually have a look, proper recorded video on how to make these impressions with tips and tricks. But for now, I hope that it is clear, this topic is clear to you all. So in the next video, we will be starting with another topic. I'll see you in the next video. Take care. Allah Hafiz.